term dementia is used to describe a progressive illness that can arise when a number of diseases affect the brain. A person's ability to remember, understand, communicate, and reason will gradually decline. People who are affected by dementia can also experience distressing disturbances in their mood, behavior, and may have hallucinations. There are many types of dementia, most commonly Alzheimer's disease, vascular dementia, and dementia with Lewy bodies. Although there is no cure for dementia, there are several treatments and interventions that can make life more manageable and enjoyable. Medicines have been developed that can improve symptoms or temporarily slow down their progression in some people. Early diagnosis and support, as close to home as possible, can ensure a better quality of life for the person living with dementia and their families. And people with dementia can still continue to make an important contribution to work, family, and their community.
It causes you problems because you can't remember certain things and all that, but like people's names, you get introduced to people and you totally forget their names and things like that, it's crazy.
I suppose in a way is the lack of awareness that anything different's happened to you. You just don't think that you're different as you've always been.
It was a shock to me. It was a shock to me. And I thought, oh no, but to be honest, you're just normal. Nothing different.
There's bits missing. This is right like a jigsaw and you've got some bits missing, really. But you don't know which bit is going to be missing at which moment. Somebody else has come along and had a go at it, that jigsaw puzzle, not you. That's what it feels like.
I mean, as I say, I still try and keep active, which I've always done anyway. And that's it. Just got to keep going all the time. There's no way I want to give up.
And that's the silly part of it, that you think you're functioning okay. In fact, you know inside you can't be. But you carry on as though you are.
Sometimes I only make perhaps one mistake a day. I don't think that's often. I generally make 2 or 3 mistakes, but
This afternoon I meant to be going to go and do, what was it now I was telling you? Water aerobics and things like that. And I play golf and tennis and all these sorts of things.
They need a lot of help, with clothing, cooking, everything, isn't it really? Yeah.
I don't cook as well as I did.
When I became a member of the Alzheimer's Society, then the care worker came to see us and assessed us and gave us any information that we needed, any help that we needed. I think he knows that he's not able to do what he could do before.
Well, basically, I know that I can always come here. No, this is the person, or this is the place. It helps me.
Okay, well, I work for the Alzheimer's Society, and people frequently call in to us either when they've been given a diagnosis of dementia, or if they have concerns about their memory and they want support. I think it's vital in that somebody who has fluctuating memory knows that there is a designated person at the end of the phone who can support them. So they haven't got to stop and think, well, who do I need to ring for this, that and the other problem? I mean, I think continuity of support is essential to provide the best possible service that we can. I mean, that is what people with dementia are, is fundamental, is what they're entitled to.
It doesn't worry me at all, at all. I mean, I do so much and I enjoy myself.
With change, nothing much has changed. Obviously, you do actually realise how much your mum actually does for you, and when you actually have to help out a bit more and do more yourself. So with I sometimes occasionally feel, I don't know, a bit guilty sometimes leaving her.
So I work across community and hospital settings, across health and social care groups to raise awareness of people with dementia, early detection and diagnosis. We heavily encourage people, if they have concerns about their memory, to approach their GP at the earliest possible opportunity. The earlier you treat, the more responsive the condition will be. And it's also about lifestyle planning, looking at people's strengths and looking where their needs might be in order to support them to live a long and fulfilling life within their own community environments. The rapid response team at East Surrey is quite unique in the fact that it has mental health nurses embedded within its own team. So that means that clients within locality health and social care teams get quicker access to mental health support and advice.
It's really important to seek advice quickly, because if there is a treatable illness there, the GP should be able to treat this. But it's also important that the GP refers for an assessment at a specialist memory clinic, so the exact cause of the forgetfulness or the dementia can be established by a specialist.
One of the services that I run is a memory service with the multidisciplinary team that I work with. GPs refer in patients who are concerned about their memory, and we offer a comprehensive assessment. It can either be in a clinic setting or in the patient's own home, according to their need. They will be seen for about an hour for a very detailed assessment, accompanied by a friend or relative that they feel comfortable with. And after that initial assessment, I will consider whether they need further tests, such as blood tests or brain scanning, or in some cases a neuropsychology assessment to gain further information about their memory problems. I will hopefully then be able to come to a conclusion about whether their memory problems are part of normal ageing, or if there is a more significant memory problem that can be diagnosed. Having established that, I will then try and tailor a care package according to the needs of that particular patient. That will include appropriate drug treatment, groups such as memory groups, occupational therapy assessments at home to make sure that people are able to live independently in their own homes as long as possible, and also signposting to other local services. The team of professionals I work with can really dip in and out of a patient's care as necessary over the course of their illness, and really provide tailored care at that particular point. The other really good thing that's happened over the last couple of years is all the memory services our trust run in Surrey have links with the Alzheimer's Society, and this means that actually at the point of diagnosis we can immediately make a referral to a professional from the Alzheimer's Society who often do clinics alongside us, but obviously patients can also be seen in their own homes, and I think that initiative is something that really patients and carers have appreciated a lot.
The Society supports information, advice and care for people with dementia and carers. In Surrey we have a range of different services, day support services, home support, support groups, both those for people with dementia and also for carers, and we have dementia cafes and singing for the brain groups. Our work with Surrey County Council and Surrey Health includes trying to help all organisations working in the field of dementia with training and focusing care, particularly in hospitals, and how people are supported on hospital wards with our county hospital at the Royal Surrey and other hospitals across the county as well. Helping to encourage people to not go into hospital, helping carers understand coping mechanisms and ways of supporting somebody for longer at home, but if by necessity they have to go into hospital, helping the hospital understand the needs particularly of people with dementia, and trying to encourage people to come back out into the community rather than having to go into a care home, which sadly seems to happen quite often.
What we actually did is we did a 9-month trial within the Surrey region, specifically looking at target areas to take our already good and excellent service and take them to the next level. And one of our core values is seeing our services and seeing life through the eyes of our customers and our service users and residents. So what we did is we created an experiential training package where the staff could really get a feel of what it might be like to be an older person living with dementia. There's lots of games and active discussion and involvement, and all the staff within the care home environment actually undertook the training. We also look at creating quite homely and friendly environments. So we looked at the use of retro style, so 1950s, 60s, 70s style lounge areas, and cues cues and clues to help people find their way around the home. The facilities that we have here, we have a day centre, which is the gateway to go on to respite and even to permanent care. We also have a tea room here. We've got chickens, which is for animal care. Again, it's for the service users. The idea behind it is all activity-based care. It's ABC. Activity-based care is all about having something that the service user actually feels complete with what they're doing. And we've also got a pamper room. The pamper room, again, is for one-to-one time with that service user, and it's also taken them out of their everyday environment. We actually have a swimming club. This is very new to Kingsley, and there's been such an impact with this swimming.
I work for Friends of the Elderly. My role is specifically to engage with the British Asian community of walking, raising their awareness of dementia and encouraging people to access help and support. Most of the elderly people in the black and ethnic minority communities are taken care of at home by their family members. So it is very important for me to bring it across to them that they can access service and they need to be better informed in order to take care of their elderly at home.
In Surrey, there are currently over 14,000 people living with dementia. This figure is predicted to rise by 46% by 2025, generally due to people living longer and a combination of lifestyle and environmental factors. Age is the predominant factor, although dementia is not exclusive to older people. Younger people from their mid-30s onwards can develop what we call early onset dementia. People with learning disabilities are also at greater risk of developing dementia. Across Surrey, health and social care organisations are working closely together with the voluntary sector to develop world-class dementia services that will support the growing number of local people living with dementia. We are planning a number of changes that will improve access to information, support and services. 1. Launching a public awareness campaign. 2. Creating a dementia navigator role where the individual living with dementia is supported from diagnosis throughout their illness. 3. Ensuring more people are supported at home rather than in hospitals or care homes. 4. Creating local memory services where people can be assessed. 5. Providing specialist home care services. 6. Ensuring more support for carers. 7. Promoting telecare equipment that can help people live at home. 8. Providing personalised services in residential and nursing homes. 9. Ensuring easy access to tailored day services. And 10. Delivering good services for young people.
I tell everybody about it, you know.
So much proud of it.
Might as well.
I think you're very good at that for living well with dementia.
Receiving a diagnosis of dementia is serious. We are trying to encourage people to live well with dementia. There are ways of supporting people and their carers to continue to live active lives in their own communities. For information on the condition, diagnosis, symptoms and carer support, please visit these websites. The Alzheimer's Society website at www.alzheimers.org.uk. Their telephone number is 0845 300 0336. The Department of Health website at www.dh.gov.uk. And for information on mental health services in Surrey, visit www.firststeps-surrey.nhs.uk. And we have our own information point. The Surrey Information Point website is at www.surreyinformationpoint.org.uk.
The term dementia is used to describe a progressive illness that can arise when a number of diseases affect the brain. A person's ability to remember, understand, communicate, and reason will gradually decline. People who are affected by dementia can also experience distressing disturbances in their mood, behavior, and may have hallucinations. There are many types of dementia, most commonly Alzheimer's disease, vascular dementia, and dementia with Lewy bodies. Although there is no cure for dementia, there are several treatments and interventions that can make life more manageable and enjoyable. Medicines have been developed that can improve symptoms or temporarily slow down their progression in some people. Early diagnosis and support, as close to home as possible, can ensure a better quality of life for the person living with dementia and their families. And people with dementia can still continue to make an important contribution to work, family, and their community.
It causes you problems because you can't remember certain things and all that, but like people's names, you get introduced to people and you totally forget their names and things like that, it's crazy.
I suppose in a way is the lack of awareness that anything different's happened to you. You just don't think that you're different as you've always been.
It was a shock to me. It was a shock to me. And I thought, oh no, But to be honest, you're just normal, nothing different.
There's bits missing. This is right like a jigsaw and you've got some bits missing, really. But you don't know which bit is going to be missing at which moment. Somebody else has come along and had a go at it, that jigsaw puzzle, not you. That's what it feels like.
I mean, as I say, I still try and keep active, which I've always done anyway. And that's it. Just got to keep going all the time. There's no way I want to give up.
And that's the silly part of it, that you think you're functioning okay. In fact, you know inside you can't be. But you carry on as though you are.
Sometimes I only make perhaps one mistake a day. I don't think that's often. I generally make 2 or 3 mistakes, but
This afternoon I meant to be going to go and do, what was it now I was telling you? Water aerobics and things like that. And I play golf and tennis and all these sorts of things.
They need a lot of help, with clothing, cooking, everything, isn't it really? Yeah.
I don't cook as well as I did.
When I became a member of the Alzheimer's Society, then the care worker came to see us and assessed us and gave us any information that we needed, any help that we needed. I think he knows that he's not able to do what he could do before.
Well, basically, I know that I can always come here. No, this is the person, or this is the place. It helps me.
Okay, well, I work for the Alzheimer's Society, and people frequently call in to us either when they've been given a diagnosis of dementia, or if they have concerns about their memory and they want support. I think it's vital in that somebody who has fluctuating memory knows that there is a designated person at the end of the phone who can support them, so they haven't got to stop and think, well, who do I need to ring for this, that and the other problem? I mean, I think continuity of support is essential to provide the best possible service that we can. I mean, that is what people with dementia are, is fundamental, is what they're entitled to.
It doesn't worry me at all, I mean, I do so much and I enjoy myself.
With change, nothing much has changed. Obviously, you do actually realise how much your mum actually does for you, and when you actually have to help out a bit more and do more yourself. So I sometimes occasionally feel, I don't know, a bit guilty sometimes leaving her.
So I work across community and hospital settings, across health and social care groups to raise awareness of people with dementia, early detection and diagnosis. We heavily encourage people, if they have concerns about their memory, to approach their GP at the earliest possible opportunity. The earlier you treat, the more responsive the condition will be. And it's also about lifestyle planning, looking at people's strengths and looking where their needs might be in order to support them to live a long and fulfilling life within their own community environments. The rapid response team at East Surrey is quite unique in the fact that it has mental health nurses embedded within its own team. So that means that clients within locality health and social care teams get quicker access to mental health support and advice.
It's really important to seek advice quickly, because if there is a treatable illness there, the GP should be able to treat this. But it's also important that the GP refers for an assessment at a specialist memory clinic, so the exact cause of the forgetfulness or the dementia can be established by a specialist.
One of the services that I run is a memory service with the multidisciplinary team that I work with. GPs refer in patients who are concerned about their memory, and we offer a comprehensive assessment. It can either be in a clinic setting or in the patient's own home, according to their need. They will be seen for about an hour for a very detailed assessment, accompanied by a friend or relative that they feel comfortable with. And after that initial assessment, I will consider whether they need further tests, such as blood tests or brain scanning, or in some cases a neuropsychology assessment to gain further information about their memory problems. I will hopefully then be able to come to a conclusion about whether their memory problems are part of normal ageing or if there is a more significant memory problem that can be diagnosed. Having established that, I will then try and tailor a care package according to the needs of that particular patient. That will include appropriate drug treatment, groups such as memory groups, occupational therapy assessments at home to make sure that people are able to live independently in their own homes as long as possible, and also signposting to other local services. The team of professionals I work with can really dip in and out of a patient's care as necessary over the course of their illness, and really provide tailored care at that particular point. The other really good thing that's happened over the last couple of years is all the memory services our trust run in Surrey have links with the Alzheimer's Society, and this means that actually at the point of diagnosis we can immediately make a referral to a professional from the Alzheimer's Society who often do clinics